All right, are we all good to go?
I think they're good.
Oh, sorry, that's more important. Well, thank you all for coming down to the beautiful Bayside suburb of Frankston. Nice to see you all here. Hopefully we're as much of your day as I possibly could. We're good to go? All right, good morning everybody. Welcome to the Frankston Vaccination Hub here in Bunurong Country. And can I just acknowledge the notes of the lands on which we're gathering and pay my respects to elders past, present and emerging, especially on this important day. So here we are at the Frankston Community Vaccination Hub, again, where we're doing literally hundreds, almost thousands of vaccinations every single day, both on our third dose booster programme and of course on the 5 to 11 youth programme. And it's really fabulous to be back here again and to see even today on Australia Day children coming through to get that all important vaccination. And my thanks to the whole team here from Pediatric Health and Monash Health who are working 7 days a week, almost around the clock to get those vaccinations done. That's really how we're making this difference. In terms of vaccinations, yesterday across the state, 25,465 doses were delivered. Again, another solid day. That's over 90,000 doses delivered over the last 7 days. And even in this holiday period, it's really good to see people coming forward and getting their vaccinations done. We're now well over a third of the over 18s population have had their booster dose, are now triple vaccinated. But we still have over 2 million Victorians eligible today to get their third dose, and I'd really encourage people to come forward and get their booster dose done, make that appointment. There are literally 189,000 appointments available today at our state clinics to get your booster dose done, or of course you can go to your GP or you can go to a pharmacist to get that booster dose. But please do not delay any further. Let's please make this a priority as we start to turn our minds towards going back to work and in fact going back to school. Of the 189,000 doses appointments that we've got available for your third dose, 2,800 are available right here in Frankston in the next 7 days. So we're really racking up as much capacity as we can, and if all those appointments get filled, we'll put more appointments into the system so that everybody who wants to get and needs to get their booster can get that done. We are steadily seeing an increase in the number of people who've got their booster doses done. Now 58% of those over 70 are fully vaccinated, and almost half, 49% of those over the age of 60, and those between the ages of in their 40s and 50s, again over 4 in 10 of those are now done with their booster program. So we're getting there, but again we'd like to see a little bit more pace and urgency to come through in the days and weeks ahead. In terms of the 36 fantastic 5 to 11 sites that we now run across the state, and this is one of the original sites we've been running, now almost 200,000 children have now had their first dose vaccination, the Pediatric version of Pfizer, 197,414 to be exact, and over 4,500 of them done yesterday. So really fantastic. I just want to thank particularly the specially trained staff we've got both here in Frankston and across all the other 35 paediatric vaccination sites for the special care and attention they're taking with our youngest Victorians to create a safe and trusted and confident environment for them to get their vaccination done. There are now 70,000 bookings available for people to continue to bring their children forward and get those all-important doses done. I would really encourage you, particularly over the next few days as we start to prepare for going back to school next week, please make it a priority to get your child vaccinated. We've got over 900 appointments right here at the Frankston Vaccination Hub for 5 to 11s over the next few days to come and get children vaccinated. We have over 1,500 appointments at the Royal Exhibition Building. We've got 1,500 appointments at Caroline Springs Leisure Centre. We've got over 1,400 appointments at Melton, at the old Bunnings site. We have over 1,300 appointments available at Sandown Racecourse. We've got almost 1,000 appointments available at the old Ford factory at Campbellfield, and over 900 available at the Cranbourne Turf Club. And as an example, in regional Victoria, we've got over 1,400 appointments available at Shepparton, and almost 500 available at the old Ford factory in Geelong this time. So again, you can go to your GP, you can go to your pharmacist, you can go a number of places to get the 5 to 11s done, but please get it done, and let's get a really strong and effective and safe start to the school year, and one I know that all children are looking forward to getting on with. In terms of our case numbers, today is I'm afraid a significant day. We've now reported 35 deaths in the last 24 hours. Those have come over a number of days in the preceding period, but that is the highest number, a highest single day number that we've reported in the entire pandemic. And our thoughts and condolences are with all our families and friends of those 35 Victorians who have been reported as having passed away with COVID in the last few days. It is again a sombre milestone that we should all reflect upon, and highlights again the importance of all the work that we're doing as a community to minimise the amount of COVID transmission, and of course to ensure people are protected through the vaccination programme. We have today 1,089 Victorians in hospital with COVID. That's slightly up on yesterday, but still remains at a fairly stable number, and 113 in intensive care, of whom 40 are on ventilators. Again, those numbers are slightly down on where they were yesterday. But it means still that we've got over 1,000 Victorians are now receiving care in our hospitals with COVID, and again, really putting a lot of pressure on our fabulous health staff across so many of our health settings to provide that extra care that they need. And of course, recognising that so many Victorians are waiting for their elective treatments that we're currently on hold, while we deal with this, what we hope will be the high point of this current wave of the pandemic. 2,612 health staff currently on furlough, either sick with COVID or looking after people with COVID. And of course, we wish them all the best for their recovery, so they can go back to the important work that they and their colleagues do right across our state, right across our health system. In terms of today's case numbers, we've got 13,507 cases of COVID reported in the last 24 hours, and again a similar picture to the last week or two. 6,533 coming out of our PCR testing system, 6,974 reported as positive rapid antigen tests. And can I just thank all those Victorians who are using rapid antigen tests now to really check in on their symptoms. It's a great early way to establish whether you are positive or not. Of course, you get a very quick result within 15 minutes, and you can report that immediately through our online system and get all the support and attention you need, both from a clinical point of view as well as any other welfare or relief that you may need. The reporting system has been going extremely well. We're really enabling us to get a lot of care to people who otherwise would not be able to access it. In terms of our PCR system, we are now really in a very stable period. Over 9 out of 10 results, test results coming back by the next day. Just under 35,000 tests reported yesterday. I would just note, although we have clearly some challenges with the hot weather we're dealing with at the moment, and there are a number of sites that are having to shut down for periods when the weather is very hot, on average we're seeing well under half an hour waiting times now across all of our state testing sites, the 250 plus sites we're offering across the state. You will be seen quickly, you'll get your test result 9 times out of 10 by the next day. So if you've had any concerns about coming forward to get tested, please come back into our testing system. If you're having problems getting hold of a rapid antigen test and you need one because you're concerned about your symptoms, over 75 of our sites are now using rapid antigen testing as well. You can access them to ensure that you can get your symptoms checked. So please, the testing system is now in a very strong position to support us over the important weeks and months ahead. And in terms of rapid antigen test distribution, over 2.2 million of those rapid antigen tests distributed over the last couple of weeks through our various health and testing sites and sensitive settings. 1.5 million being distributed this week again through our health and sensitive setting sites. So we're starting to see really a much better level of availability of rapid antigen tests where they're needed. And if any Victorians are concerned about needing to check for their symptoms, please come to one of our testing sites. You'll either be offered a PCR or a rapid antigen test. Finally, in terms of the impact that all this vaccination effort that we're seeing here at the Frankston Vaccination Hub makes, there are now only 6% of the community has not yet been vaccinated at all, but over a third of those in ICU are currently unvaccinated. To turn it around another way, over a third of the community is now triple vaccinated, has been boosted, and yet less than 6% of those in ICU have had 3 doses of the vaccine. Fundamentally, the vaccine is the best way to avoid ending up in hospitalisation numbers and ending up in intensive care. I'd urge those remaining Victorians who are eligible to get their vaccination to please come forward and get their dose done at the many points of access we have across both the state system and, of course, through our GPs and pharmacies. With all that, I'm happy to take any questions.
Jeroen, did you mention it's the highest death tally today? There's many days with 59.
Yeah, certainly rich in my memory. So maybe it's only in the last 18 months or so, but it's certainly been one of the highest days for a long time.
And with the people who are dying, what's the vaccination status of those?
So I don't have the details of the 35 today, but what I can say of the, we've seen obviously significant numbers of Victorians passing away, particularly through the Delta and the Omicron wave. So if I look at the people who've passed away since around July, August of last year, over half of those were not vaccinated. So 53% of everybody who's passed away with COVID since around July of last year, 53% of those were not vaccinated, 47% were partially or fully vaccinated.
Are you concerned about the vaccine rollout in our aged care homes? There are some reports that people aren't getting their third dose as soon as they should.
Yeah, look, we continue to work very closely with the aged care sector. So all of the residents and all the public sector residential aged care sites were offered and were provided with third booster doses before Christmas of last year. We've been assured by the Commonwealth that they will complete all the private residential aged care facility booster program by the end of this month. And obviously we're talking to them on an almost daily basis to ensure that they do just that. And we're very keen to ensure, seeing how important the booster dose is in minimising people's chances of ending up in hospital, that booster dose program is completed.
I believe it after these health ones that I'm talking about. Do you know, or have you heard of people being tested in those homes and then they're being cancelled for their third dose?
Look, I've not heard those reports, and obviously I would ask you to maybe talk to our colleagues in the Commonwealth around that. Look, we think it's one of the most important areas of focus now. As we see the sheer number of cases every day, we know there are significant numbers of exposures inevitably at aged care sites, and the vast majority of those aged care facilities are doing amazing work along with their staff, both to minimise the impact of COVID in those settings and to look after the residents in their homes ultimately with those symptoms. But critically important that booster program is completed on time. We were assured end of January will be done by, and if we need to support that program, then we're only too happy to help.
Just on the tests with mine, I believe the CHO gave advice relating to the spreads go to 65%. On what basis was that advice given?
Yeah. Simon, you'll be aware. I'm not the Chief Health Officer, but I'm aware I'm from the department. I'm aware that certainly Brett in the last day or so has lifted essentially the cap that we imposed on the stadium level events. So there was a cap of 50% initiated just before the Open started. There were, I think, some situations where if there had been ticket sales beyond that level, then they could stand. But Tennis Australia were asked to sell up to 50% of the seats of the tournament. Brett, I think, has reviewed the position over the last couple of days and has lifted that floor to 65%, so that up to 65% of the seats that have not yet been sold can indeed be sold at this point.
And last year, you well remember the outbreak that occurred at Weimar Park. You were front and centre then. There has been concerns that the number of crowds at Kippy there on Thursday night for the soccer has not been tapped. Now that the 65% decision's been given to the tennis, I guess, has there been any review, are you aware of, that the show may have done on the crowd at Amy Park?
Yeah, I'm not aware of any review on Amy Park, and happy if there's any update on that to put that in the show release later on today, Simon. But look, I mean, obviously I think we're in an environment now. Let's remember this is a very different era to where we were dealing with the Delta outbreaks and the Kappa outbreaks, in fact, in that May-June period of last year. We are, I think, as a community, far more aware of the high level of community transmission we're still seeing around us. Again, 13,000 cases today. These continue to be very, very high numbers, even if they're down from the peak of a couple of weeks ago. And of course, that's why the measures that we continue to do as individuals, so that the mask wearing protocols become so important, that social distancing becomes important, and of course, making sure we're keeping a very close eye on our symptoms. So I think we are in an environment where we're seeing far more events take place, and far more activities take place. I think on balance, that's what we all want to see as we start to move towards some form of normality, recognising that we've still got a number of measures that we need to keep on top of.
Jeroen, what are you expecting by way of case numbers, and maybe hospitalisations, ICUs, when school goes back? Perhaps also, maybe even today with Australia Day, many more gatherings today. What do you expect?
Look, I think firstly on gatherings, I think what we've seen and what we've seen Victorians do over the last few weeks is to make good use of the summer. So I think we've seen far more outdoor events. We've seen far more people they're entertaining, they're socialising outdoors. And I think that's been a part of the story of the slight drop in case numbers, or the significant drop in case numbers we've seen over the last couple of weeks. We saw a peak coming out of the immediate Christmas party period. I think a bit of a reduction since then as people have adjusted their behaviour, and we've seen it in a number of other metrics in terms of the mobility metrics, the retail metrics, all indicate that people have all adjusted their decisions and how they spend their time. I'm not too concerned about individual one-off events, but I think as we head into schools reopening, we will see more people getting back into those school settings. I know schools have worked really hard to introduce air filters, to rethink their lesson programs, to rethink how kids move around schools, and to bring as much of the activity outside as they can, particularly over the remainder of the summer and autumn months. So I think all those individual steps will make a difference, but we should expect to see, I think, over the days and weeks ahead, continued high case numbers that we're seeing at the moment. We don't expect those to drop off very rapidly in the immediate future. I think there'll be a bit of a bump in those numbers over the next couple of weeks as we wait and see how people go back to work and how those schools go back again. Yeah.
How are we going? I know you mentioned we still need a little bit more urgency.
Yeah.
How are we going compared to projections? Are we still falling behind in that field, or are we on track?
Look, I think what I said booster program is, I mean, it's a glass half full, glass half empty argument. At one level, it's great to have 34% of over 18s having got their booster done really during this kind of holiday period when everyone's in a slightly different frame of mind than normal. There is plenty more capacity for people to get their booster doses done immediately, so we could certainly see a lot more people coming forward over the coming week or two and kind of catching up on that program. And I'd love to see those numbers lifting, whether it be through primary care or through the state clinic system. So I think it's increasingly down to us as individuals to do what's right for us and to do what's right for those around us. And I think there's been plenty of announcements, there's been plenty of press conferences. There's a lot of capacity in our primary care system, and there's a lot of capacity in our state system. So we'd encourage people to come forward and get the vaccination done, because it shows in the numbers you're far less likely to end up in hospital and far less likely to end up in ICU if you've had your booster dose.
How many exemptions have been given to COVID positive health workers to go and work with COVID positive patients? I know there's been a case in around his area with disability workers who wasn't working.
Yeah.
How many exemptions?
I'm aware of one, Richard. So there is one instance I'm aware of, and I won't go into the details given the confidential reasons, but it's a home, a private home with a number of people who are all COVID positive, who are receiving specialist disability services from a disability provider. The disability provider have a regular group of staff of 3 staff who provide services to that particular household. Clearly long-standing, trusted, caring relationships, and some of those staff members were COVID positive, and they sought an exemption through our Deputy Chief Health Officer to continue to work as they were asymptomatic. A number of controls were put in place. No other, given it was a private home with only COVID positive people in it, and everyone was aware of that setting. On that one occasion, our Deputy Chief Health Officer made the decision to allow that arrangement, and given the controls that were in place.
Do you expect many more of those around?
No, look, it's an exceptional arrangement given the very unique situation you've got, where you've got, particularly in the disability care sector, where you do have complex relationships between the carers and the patient, where you can't just switch people in and out at a whim. In this particular situation, that was the right call. A lot of time and thought went into the preparation for that, and a decision was made, given the controlled setting, that was an appropriate thing to do. Does that mean it will never happen again? No, I'm sure there will continue to be very one-off situations where that might be the most appropriate course of action, but it's very much an individual specific exemption rather than a wider application.
Jeroen, what's the shape of the outbreak? Is it still young people that seem to be getting it more? Are there any particular areas?
Sorry, I interrupted. No, look, I think if you recall, certainly 3-4 weeks ago, in that immediate post-Christmas New Year period, we had a really strong drive in the people in their 20s and 30s, who disproportionately account for the numbers. I think at one point we had around almost 2/3 of all the cases from people in their 20s and 30s, really driving those numbers. Those proportions have really come down in the last 2 weeks. It's a much more evenly spread across all of our age groups, so there's no specific geographic or age profile of it. We're now seeing it kind of running through different parts of the community, but it's still very much within all of our controls. If we do all the simple measures around socialise outside, see people outside, a bit of social distancing, a bit of mask wearing when you're inside, and hand hygiene, makes a significant difference in running those numbers down, and we can see that in these case numbers. 2 weeks ago we were reporting cases in the 40 and 50,000s. We're now kind of running in the mid-teens. I expect to be running in the mid-teens probably for a number of days yet, but I think it does show that all those individual behaviours that have been adjusted are making an impact on those case numbers, and that all flows into our hospital system. All good? All right. Thank you all. Enjoy your days on the beach. Thank you. Thank you very much. All right.
Last 8 minutes.
There we go. All right. I'll see you all.
Good to see you too. Thank you. Take care, Jeroen. Thank you, Larson. Thank you, all boys.
Hey, I'll just see Jeroen out. I'll come back and sort you out with some cooling and
Yeah, sure.
What are you thinking?